Good afternoon. I'm David Summers. I'm the publisher of the Long Beach Post and Long Beach Business Journal. Thank you for joining us for today's daily live chat. As we're going through today's conversation with Dr. Mauricio Heilbron from St. Mary Medical Center, if you have questions, if you have comments that you'd like to pose, please add them into the comment feeds on our social media pages where you're watching this conversation, and we'll get to as many of those questions as we can. But there's been a lot of news today that I want to just start with, because it's relevant to today's conversation. Just a few minutes ago, Governor Newsom did order the closure of indoor operations at restaurants, museums, and other indoor facilities in LA County and a number of other counties for 3 weeks, kind of in advance of 4th of July festivities and crowds. Doesn't mean that restaurants are shutting down, but those activities are kind of dimming down while the focus is more on outdoor things and reminding people about keeping their distance in the middle of the COVID pandemic and the crisis we're in. Dr. Mo, it's been a few weeks since you last joined us, and it's always fascinating to hear from you kind of what's going inside our medical facilities. How are you, and what's it been like inside since we last spoke?
How am I is a complicated question, but what's it like inside? It's not getting any better than since last time we talked. I mean, there's no scientific reason we should have opened up. We know that, right? Economic reasons are valid, and those were used, but there's not a single shred of scientific evidence that we were ahead of this thing, that we were making any progress. We're still in the first wave. There's been no pause. In fact, it's only slowly gotten worse.
As a medical professional, someone well qualified to speak about what we should or should not be doing right now, what's the advice that you're giving people about how they should be acting, how they should be behaving right now?
We need to go back. We need to behave. We need to wear our masks. We need to social distance. We need to do what we were doing before, because when we relaxed, look what happened. This is evidence. This is science. This proved to us that we weren't ready to go back. My advice now is for the people that are somewhat hesitant to accept these measures, they need to understand we tried this. It didn't work. We need to go back. We need to protect our families, ourselves, other people. We need to wear masks.
Doctor, you spoke about protecting families. What are you doing with your own family and those close to you? How are you living your life right now? What are the things that you're not comfortable doing and don't imagine you would be comfortable doing for quite some time?
Well, me personally, I'm different than you. I'm different than most people because I live here. I've been working every day since February 9th at this hospital or in my office. I haven't had a day off except for my birthday. So I'm in a different situation than you are because I'm in a place where there is COVID. We know there is. But what's interesting is if I'm in the hospital, I'm wearing a mask all the time. I'm washing my hands 100 times a day. I'm very careful with my interactions with patients and nurses, which is why amongst healthcare workers, while some of us are getting sick, and we are getting sick, it's not any different, in fact, maybe less than the average population, which is something to say. So at home, I'm married, and it's a risk. We behave like married people. We don't distance. But she does not go out. She has not done a lot out in the real world. Always wears a mask when she does have to. So we're mitigating and limiting our exposure. Her exposure is going to come from me. So it's beholden to me to be very, very careful. And I get my son every other week, same thing. To protect my family, I have to be exceedingly careful of what I do. And what do? I wear a mask. I wash my hands. I social distance whenever possible.
You mentioned before we started this that you're in the middle of a 54-hour shift. Can you talk to us about how you're interacting with COVID patients, how you're interacting with patients in general? What's it like in how you're interacting with patients lately that is different than before?
There's a couple of answers to that. One is, have I had to take care of COVID patient specifically, yes. And several weeks ago, we had a very, very sick patient in the intensive care unit, and they called me to do some sort of procedure at the bedside to keep this patient alive. I'm in the middle of a COVID unit, surrounded by COVID patients, taking care of a COVID patient, doing something that is somewhat invasive at the patient's bedside because they're not able to move. I will be honest with you, it's been a long time since my hands have shaken a little bit, and they shook a little bit. It was nerve-wracking. Now, everything went great, and actually the patient off the ventilator is doing better a couple weeks later. So yay for that. But let's get back to a regular patient. On the floor, when I see a patient, I maintain that social distance. And we're very careful. I will sit in the chair and talk to the patient, but I'm sitting 6 feet away. There's ways of doing it right. If I have to touch the patient, I gown up, I glove up, I put my mask on. Patient often puts a mask on. If I have to look at a wound or do something closer to the patient, but often I can just talk to the patient. And you can do that in social distance at the same time.
We have a question in from the community, and if anyone out there does have a question for Dr. Heilbron, trauma surgeon and leader at St. Mary Medical Center here in Long Beach, please do send that in the comment feeds. But the question is, have you noticed if there's been any changes in how the virus is transmitting? Is it airborne? Is there any is surface to surface less of a concern now? Has there been any evolution in what we know about this virus and what it's doing and how it's acting?
There is, yes. The answer is there is an evolution of what we know. Literally every day we are learning something new about this sucker. And all of it isn't good. I'm sure you've heard about the different symptoms. Some people have nothing. They're totally asymptomatic. Some people have respiratory issues. Some people have a weird skin rash. Some people can't smell. This is the pathophysiology of this virus we do not have nailed down yet. So what have I seen personally? From what I see in the hospital and when I read about, it appears that the virus is spreading, which makes me think it's more respiratory than contact, which sort of makes sense for a respiratory spread virus. But a lot of people in the media and the news have said that it looks like the death rate is going down. Less people are dying compared to the number of people that are diagnosed. I think that's important because people are still dying. Mm-hmm. And I think the reason they might be dying less is that we're getting better at keeping them alive. Mm-hmm. I think we're learning too. The scary part, though, is if you look at the raw numbers, the testing numbers are going up. And you can attribute that to more testing. But the percent of people that are hospitalized is also going up. And that's independent of the numbers. So it's getting worse in that more people are getting sick enough to get into a hospital. But it also looks like the medical community is getting better at dealing with them.
You mentioned observationally that numbers are going up. Is there anything that you can share with us or estimate about how many COVID patients are hospitalized in your hospital right now?
I don't have the exact. I didn't have the number today, but there's a lot. We have intensive care unit modules that are dedicated to COVID patients, and they're full. We have too many. Is the short answer. We have a lot. Now, that doesn't mean like, oh my God, we're falling off a cliff and we can't handle it. I'm just saying that the wave isn't over. There's been no break. There's been no lull. If one goes home, one comes in. It's a continuing process. It's a steady stream.
Is there any concern at this point that there isn't enough capacity? Are you concerned that we may hit that peak, or do we have enough infrastructure locally at the time? I mean, we've lost some things like the Navy hospital ship. There are fewer places, overflow places. But do you feel like, at least in your observation at this moment, that we have enough to handle that increase?
The honest answer is I think so. The medical community, whoever is smarter than I am, thought that we'd be breathing by now. We'd have a break. We'd be able to recover. But you have to understand, we're scrambling. We've been scrambling since February to try to catch up and figure out how to do this. Because we don't know how to do this. We don't know how to handle a pandemic. You brought up the boat thing. Most people don't realize the boat was sent over there, but then we had to make up processes on who goes to the boat and who doesn't. Sure. What sort of documentation we do? How do we select that? So we didn't have that planned ahead of time. We were just sort of making this up. Now, you've probably heard in the news that Riverside County is getting pretty full. They're predicting their ICU beds are full. Yes, it is a concern in the medical community, and it's something every day we're aware of. But we still have to do what we have to do. So non-medical people can worry about it and notice it and read about it and be concerned. But us, we have to do that and take care of people and take care of the patients and make sure we're doing the right thing and taking care of the people that get in car accidents, the people that have heart attacks, the people that are still getting sick. Yeah. So it is a challenge, and it is kind of inspirational to see how the doctors and the nurses and the techs and the housekeepers, the people that actually work in the hospital, how we're doing this, despite all the other stuff, despite problems from the government, despite the problems with administration, despite the external stuff from the public and the media. People here, they got their S together.
We were talking a little bit beforehand how a few weeks ago I stupidly, dumbly injured myself and ended up in the emergency room right there at St. Mary. And I was a few blocks away and needed to go to the ER right away. And it was terrifying, the idea of going to an ER in the middle of a pandemic. But my personal experience was I felt completely safe because of how much had been done to separate out one for the other and to triage people before they even stepped foot inside the hospital. It was very quiet, very calm, very compassionate. And so from a personal experience through this right now, I still would prefer not to be in a hospital if I don't have to, but at least it was as orderly as it could be.
Well, let me put it to you this way. What if the argument could be that you're actually safer in our ER than a restaurant right now?
That's a really good point. So let me ask you then, what about all the people? One of the things I've noticed is a lot of folks on Facebook right now saying to be damned with what the governor is saying or what health leaders and trained experts are saying. We're going to go to the beach this weekend. We're gonna do whatever we want this weekend. What would you say to people who are publicly saying that they're going to flaunt stay-at-home orders? They're going to go to a yoga class at a fitness center, that they're going to go to the beach and protest. What do you think about when people are saying that and that statement?
What do I think about it? It is hard for people to understand how just insulting and demoralizing it is for people to tell us, the medical people, that we don't know what we're talking about, and they get mad at us for being wrong. Like, well, you guys didn't say we needed masks before, and now you need masks, and they don't. I try to explain. We try to explain. We're learning about this. Going to the beach, is going to the beach in and of itself going to get you COVID? No. And in fact, if you're on the beach and there's nobody around you, and the air is blowing and it's a cool breeze, and you're not going to get COVID. The problem is 150,000 of your close friends are going to join you on the beach, and then you're going to go up the street to a bar. And it's the public, unfortunately, isn't as smart as they think they are. And I know that's a bad sentence, but people think they know more than they do, and they choose to believe what they want to believe instead of data. And that's what I mean by information and data. There's no data that says it's okay. That's the problem. Psychologically, economically, I totally understand. And we have to be creative, and we have to be aggressive in finding ways to salvage our economy, to maintain our psychosocial health. But we have to be creative and do it, but we have to do it safely. We can't ignore the masks and the distance and the fact that this virus has no treatment, no vaccine. We don't even have good tests for this virus. Our tests, honestly, suck. We're having to repeat them. We can't get them when we want. I don't know why the government says we can get tests whenever we can when we're struggling to get them here in our hospital. They run out. We have to struggle to get stuff. So please, people aren't going to realize until something really bad happens, and then it's going to be too late.
Dr. Heilbron is our guest for our live chat today. He is a trauma surgeon, longtime leader at St. Mary Medical Center here in Long Beach. If you have a question, please do send it in. But you mentioned tests, and we've gotten a couple questions in from the community about tests. Two questions that I want to pose to you. The first is, we're starting to see a shortage, a challenge of getting a testing appointment from locations here in the city. What's the testing supply like there at the hospital? Are there any challenges of getting a test that you've noticed? And then secondly, a question that came in, is there any concern about false positives or false negative tests? Could you speak to both of those?
Yeah, these are all the same questions that we have. So let's sort of start taking apart the tests. You know, there's different types of tests. There's the ones where they roto-rooter out your nose and then they swab your throat and then they get the blood tests. They do all this different stuff. And they're looking for different things. Some of them are antibody tests. Some of them are PCR, enzyme type tests.
Mm-hmm.
So what we need to understand is we did not know what this was in October of last year. Mm-hmm. So we had to design and make a test to find something we didn't know existed. Now, everything close to it, like the common cold or something else, can give you a false positive. And so we have to create tests that get more and more specific. Mm-hmm. Antibody tests may prove that you were exposed to it, or you really had it, but you were totally asymptomatic, or you had it and you had mild symptoms, or you really, really have it. Mm-hmm. Or you're negative now because you don't have enough antibodies to trigger the test because the tests are slightly different. So we're still hammering down on the accuracy and the specificity and the sensitivity when we're talking about false positive and false negatives of these tests. So we got to be a little bit patient. Access to the tests is all over the map. You can drive up to Dodger Stadium and get them, but we can't get them in our ER, or we can get them in the ER, but we ran out of the quick ones because we're testing so many people. So we have the ones that have a 2 to 3 day turnaround. But what if we need them sooner? You can get them in some doctor's office, but not others. You can go into some CVS's, but you can't. It's so disorganized, and that's not helpful. And too many people are using the tests just because they need to know if they have COVID. And that's what we were struggling at the beginning to get. People just wanted to know if they had it. And I'm trying to tell people, it doesn't matter if you're not symptomatic or you're not exposed. If you don't have a reason to get the test, then you're taking a test that should be used on somebody who needs it. That's my attitude. Now, later on, when we got lots of tests, and we got room in the intensive care unit, we got some drugs that work better than the ones we have now, then we can start doing more population-based studies like they're doing in other countries. And they're doing it in the other countries because they can do it safely. But we can't do it here yet.
Another question was about the governor's announcement today about slowing down. He called it the dimmer switch, that this is not just an on and off, but dimming things down temporarily. Do you think that things like closing down indoor dining and shutting down indoor activities for a few weeks will have a positive impact on community transmission, will have an impact on those increasing numbers you're seeing in the hospital? Is that a right move in your opinion?
No, absolutely. And it is a sign of wisdom when somebody analyzes a situation and then changes what they do about it. Instead of just going full on pell-mell ahead and, I don't care what the data shows. I don't care if the numbers are going up. We're going to keep everything open. To me, it sounds reasonable to see that if the numbers are going up, we do have to pull back some. That seems reasonable to me. And the restaurant thing is something that we recently opened up that seems pretty easy to take back. And still trying to keep the restaurants open. Again, creative way to maintain some sort of economic energy going, as opposed to getting rid of things like baseball, which I'm dying to see, and concerts, which I'd love to go to. And all these things, like my whole summer got canceled for the stuff that psychologically makes me happy, as opposed to living in this hospital every day for 4 months. I'm bummed, but I know why we don't go back to that. And people need to know there's a reason we don't go to the restaurants. And I wish they would accept that and not have giant gatherings and big parties, because some of the data that's coming out now is showing that clusters are related to not protests, not that sort of stuff. They're more intimate gatherings where people are closer together and not wearing masks, people where they're singing or yelling or stuff. We've seen a few church outbreaks across the country. We've seen some prison outbreaks, which is really scary. Because, talk about trying to make some difficult decisions there. So yes, I think that I'm kind of glad that something's being done proactively. We needed to do something because what we were doing before wasn't working. It wasn't. We know that. There was no lull. We haven't had a lull.
We've got about 8 or 9 minutes left with Dr. Heilbron. Dr. Mo, one of the questions I wanted to ask you was your thoughts about how Long Beach has responded, and not from the individual residents, but have we been taking the right steps here in the city? Are we doing the things necessary? I know that there's been some criticisms that we've kept things closed longer, or that maybe we should have moved faster on things. What's your perception of how the city has responded and how we're handling things kind of at the city level?
Yeah, honestly, I think we're okay. I think the city has been following the governor's recommendations. I think, and we won't know for a couple of years when we can go back and look at all this data, but my gut feeling is they've been relatively supportive, trying to walk that fine line between doing the right thing scientifically and then trying to do the right thing for the small businesses and the communities. Now, we did good with we did pretty good shutting down the schools and stuff. The teachers did an amazing job doing that. That's a Long Beach thing, Long Beach Unified. They created this off the cuff way of doing this way of teaching. I think we did that okay. My son is, a junior high school. It was difficult, but these teachers had to make this stuff up. My sister is a first grade teacher. So Long Beach School, I think they did pretty well. Now let's look at the civic leaders and stuff. I think they've been guiding us relatively calmly. I don't think there's been a lot of fireworks and fists pumping and slamming and all that stuff. I think they've been a quiet, gentle leadership, which we kind of need right now. We need a lot less yelling. I mean, I'm really upset, but I've been awake for 2 days. So normally I'm not as cranky as I am now. But I think overall they're doing okay. Nobody's perfect, but I think the fact that they realize that nobody's perfect and continually try to listen and adjust and change, I think that's mature. I think it's sensible. And I think bottom line, it's going to protect our city.
Dr. Mo, I've seen a lot of people say, well, COVID's no worse than a bad flu. Can you talk about your observations about how this impacts people? I know that there are some people who have it and really aren't impacted at all, but I know that there are over 100,000 Americans that have died so far. What is this, a bad flu? Is this something else? Talk to us about this virus. What is it? Its impact.
It's a monster is what it is. And I was one of those people back in January, early February, that based on the data, to me, it looked like a respiratory virus that was infectious, that a certain number of people were going to get sick. And I used to make the comparisons to the swine flu and to the H1N1 and other diseases where, again, late January, the first time I talked about it, there were only 6 patients in the country. But looking at the data we had then, yeah, I can see why people back then were sort of, this could be a bad flu. And then we learned more. And then things started happening, like the East Coast, the meltdown that happened in hospitals there, that I think us living in California, we may have seen some of the news reports, but until you talk to people that were there, and I got to do some media stuff over in New York and talk to some people that were in the hospital, right. It's frightening. This thing's a monster because, and I don't use that word lightly, it's an unknown virus that did not exist a year ago, that we don't know where it is. We don't know how to see if you have it. Some people have no symptoms at all. Other people die in hours. And we're finding everything in between. How come some people have horrible pulmonary problems, but then other people, they have a mild cough? Some people lose their taste of smell, or their sense of taste and smell, and nothing else. A friend of mine that I went to high school with a long time ago, she's on the East Coast, and her only symptom was a rash, a skin rash, and she tested positive. We have people in the intensive care unit where the blood literally clots in their micro vessels and their skin sloughs off. This is horrifying how different it can present. So it is sort of this unknown. I mean, if you have it, here's a scary thing. If you have it and you test positive, you don't know where you're going to be in a week. When you get the flu, you kind of know that you're either going to get really sick or you're going to get kind of sick, or you hope it's just going to be the sniffles. This one, you honestly have no idea if you're going to end up on a ventilator or you can't smell your hamburger cooking. I mean, it's crazy. So we need to learn more about it. And we need to let smart people like scientists and other doctors research this thing, gather the data, and tell us more about it. We're just learning.
We've got 2 or 3 minutes left. If there are any other questions from our viewers and our community, please do send them in the comments feed. 2 other things that I wanted to ask you about, Doctor, is I encountered somebody the other day that tried to shake my hand, and I realized I haven't shaken anyone's hand in months, and I feel like I recoiled in horror. What are the things that you think are not coming back on the other side of this? What are the things you think that at least maybe you and how you interact, or what you think from a cultural or society standpoint may be forever changed or impacted?
Yeah, it is pretty funny how you used to you used to shake hands and then you stop shaking hands and then you'd fist bump, and now we don't even fist bump, and then you start putting your elbow up. If you're ever hitting your elbow the wrong way, both people kind of walk away like, oh, let's not do that anymore. Is that going to change? Yeah, no, I think we may be more aware of that, but let me try to put a positive spin on this. What if after we get all the data, we realize that it doesn't spread by contact the way we initially thought? What if we're really, really sure it's respiratory? Now, let's say a year from now, we have better drugs. Let's say we have a vaccine, or at least progress. I think it's going to take longer than that. We've never had a coronavirus vaccine, so it's going to take a while. But let's say we have that. Let's say we have some breathing room. Let's say as a physician, I have tools now to help you when you get sick, as opposed to just sitting at the bedside and watching where you go and then stamping out fires as they show up. So is that going to come back? I think so. I would like to think so. I would like to think that hugging is going to come back. I would like to think that the Dodgers and the Angels are going to come back. Sitting next to people, we haven't done that in 3 months. I mean, just think of how weird it is. Don't you feel sometimes like now if somebody gets too close, you're like sensitive?
Yes.
You're like hyper aware.
Yeah.
That's going to take a while to go away. And I don't think that's a bad thing. I think we're learning how to be respectful of infectious diseases, not just COVID. I think we're learning that Mother Nature doesn't give a rat's ass what political party we're in or where we live or whatever. She's going to kick our ass when she feels like it. And this is evidence of that.
The last 2 questions that I want to ask you, Doctor, are you mentioned being respectful of infectious disease. How concerned are you having to deal with the fact that COVID is here and it's going to be here for a while, but then there are other things like new reports of new swine flus, the flu season is going to come back. How concerned are you about things kind of piling on top of each other in the months ahead?
I've been freaked out for 20 years. I don't know what y'all have been waiting for, but I mean, there's just the stuff that you guys don't know because it doesn't get a lot of media attention, and maybe it shouldn't, because the H1N1 from 2009, don't forget, 1 out of 6 people got that. I mean, people forget that 1 million kids stayed home from school. People forget that 14,000 people died in 9 months, and most of them were younger than 50. But we sort of got through that. But you guys, the public, doesn't really know that we had a typhoid fever outbreak in Los Angeles, or that there's been a really bad tuberculosis outbreak in New York City, or that there's a strain of gonorrhea in the South that's resistant to every single known antibiotic. There's so much stuff out there that it's almost overwhelming. And it started in the 80s with AIDS. And then we have MRSA. It was funny, 10 years ago, 15 years ago, I used to be on K-Rock, and the DJs were like, bird flu, we're all going to die of bird flu. And I said, no, bird flu is going to be fine. But there's this staph that we have on our skin that's growing now that's resistant to everything. And now MRSA is something the public knows about. It's not new, it's a resistant staph. We need new antibiotics. You know what happens when we create new antibiotics? We create new bugs that are resistant to those. So we went from staph to something called enterococcus to all these different bugs that are smarter than we are. They will learn and they will resist. And what people don't understand is how powerful this is, how much more out there we need to know. But here's some hope. You know what really kills coronavirus? Soap. Common sense goes a long way, my friend. We need to go back there.
I just want to ask you one last question because you're really starting to freak us all out. Good. Who are the people that people should be listening to right now? I wish personally it was as simple as people that look like you, dress like you, as maybe the people you want to take medical advice from. But who should people be listening to right now? Where should they be getting their advice and their direction?
So me personally, because I'm a doctor, and being a doctor means you got to go through training, and doing the training means I have to learn how to read medical literature and see if it's valid. And that's one problem with lay people, where they read a medical article and they assume it's true, or conversely, they assume it's false because they doubt everybody. But medical professionals are trained to look into an article and see, how do they evaluate this data? How do they gather it? Is it really meaningful? Anybody that can do that, you should listen to. Now, Dr. Fauci is my North Star. He is the guy, because when he talks, and if he's unsure about something, he tells you he's unsure. And when he's sure about something, he tells you he's sure. And that's a scientist. That's a guy who knows stuff. I hear too many people who begin sentences with, "It seems to me," or "for all we know," or "from what I've read." And I get that, because there's this urge to know. There's this urge to want to be reassured. There's this urge to just get an answer so we can move on with this crap. And I get that, but that's not that easy. So please, if you're going to get your information from anybody, yeah, I'd like it if you got it from doctors and scientists and stuff. That's a kind of a good place to start. I wouldn't necessarily listen to overly partisan, politicized comments. Anything that seems too extreme one way or the other is probably exaggerated. And the truth is always going to be somewhere in the middle. Again, common sense, I think we don't have a lot of it nowadays, and I think we need to go back there. And maybe ask more questions. Maybe the idea is, if you read something that bothers you, find another source, talk to somebody else. There's lots of people out there. Almost everybody knows a doctor. Half of Long Beach knows me. So I would start there.
A good place to leave our conversation today. Dr. Heilbron, thank you for taking the time and filling us in on what you're seeing and experiencing, and reminding us that COVID is still very much with us and we are not past this. Good counsel for everyone to heed. Please stay safe. Thank you. We'll wrap it up there. And from all of us here at the Long Beach Post and Long Beach Business Journal, have a good afternoon.
See y'all later.